There are some new concerns tonight as the Carolinas reopen. We thank you for joining us tonight. I'm Scott Wickersham. Well, tonight, the head of the CDC is predicting the number of coronavirus deaths in the U.S. will surpass 100,000 by June 1st. In a tweet, he said the CDC tracks 12 different forecasting models of possible deaths. As of May 11th, they said all are forecasting an increase in the coming weeks. This is coming as North Carolina prepares for phase 2. South Carolina will go through that on Monday. Right now in South Carolina, you can go inside restaurants, and this was the first Friday night for people to be able to do that. Our Aaron Edwards is in Fort Mill tonight to show us what things are looking like there.
It's been a busy night for restaurants here. We actually stopped at several places today to ask restaurant owners how this week has been going for them, and a few were too busy to talk with us. This is the second week for outdoor seating, and the first week indoor seating is allowed. But there are requirements for both, like no parties over 8 people, tables and chairs need to be 6 to 8 feet apart, and of course increased cleaning measures. Restaurant managers we spoke to say getting used to these new guidelines has been an adjustment, but they're just glad to be able to serve the community again. A few restaurants were actually surprised by the turnout this week, including Carmela's in Fort Mill. They say Monday they were extremely busy with takeout and indoor and outdoor seating.
I'm so impressed with the support from the neighborhood. Old faces have come back through, new faces just excited to get out of the house. It's been more than I think anyone anticipated, so it's pretty exciting.
While a lot of restaurants say they were busier than expected, that doesn't mean they're at capacity, as one of those requirements is only 50% occupancy. Scott?
Thank you, Aaron. Now, this time a week from now, you could be able to spend your Friday night in a restaurant. If things go well, the governor says we'll enter phase 2 of the reopening plan. That would lift the statewide stay-at-home order, allowing restaurants to open up their dining rooms at a limited capacity. Also could open gyms, salons, and entertainment venues and churches. But officials say COVID-19 is going to be in our community, and we need to keep safeguards in place until there is a cure. That's why some restaurants are going above and beyond as they get ready to reopen, or in some cases open for the first time. Our Genevieve Curtis found out how one restaurant will actually screen actively its customers.
This is the second biggest dining room.
Inside Moa Korean Barbecue and Bar, an upscale new spot in Uptown, owner Sean Kim is hoping to finish construction in 2 weeks, but he won't be ready to open for dining just yet.
But my most concern is, people around me. I don't know their condition.
While the state may allow him to serve food with paper menus and social distancing steps in place, he wants to go a step further. He's installing a thermal imaging camera and a screen at the hostess stand.
That way the customers coming in feeling a little better. It doesn't detect everything, but feeling a little better. Relief. To sit down and have a dinner, enjoy their dinner.
He already installed a camera at his restaurant in Columbia, South Carolina, where every staff member is screened as they continue to do takeout only. Here's how it works. Kim set the camera to alert at 100.4. Right now, you can see it's scanning me, and I'm registering around 97 degrees. But if we lower the temperature scan to 97, now the system alerts Kim to my temperature.
Caution. Abnormal.
The idea came from how South Korea is handling the coronavirus pandemic and how the country is opening back up.
In South Korea, their public places it's just mandatory to have these thermal cameras.
He knows there might be some pushback from customers, but Kim says he's just trying to find a way to open up safely. The pandemic has already delayed his restaurant opening by several months. He says a second or even longer shutdown would be crippling.
Well, we'll see some angry customers, turning around, but we have to set the rule and written policy in front of the restaurant.
Now, even when restaurants reopen, life gets back to normal. For some time, we still need to try to keep a social distance. Now, Mecklenburg County's health department says the opposite is happening, which would make sense as restaurants and more stores open up. This chart shows the country's estimated social distance compliance. And you can see the upward slope when the stay-at-home order started, because people had to stay home. But over the past few weeks, as things open, we've been trending down to about 40% compliance. So that all kind of matches up. Now, North Carolina's Department of Health and Human Services has ordered coronavirus testing for all residents in long-term care facilities, and we've learned that some of that testing has already begun. In Mint Hill, Medic helped to test residents at the Mint Hill Senior Living after results of testing by a private lab this week were tossed out. And in Concord, the Cabarrus Health Alliance was testing residents at their facility after a worker and 3 residents tested positive.
They are currently isolated. Our staff have the appropriate PPE, particularly our N95 masks, to take care of those residents, and they're doing just fine.
He says they should have results of the tests on the other residents sometime over the weekend. Well, we've been reporting on a particular nursing home. The Citadel in Salisbury has had the highest number of cases in the state. A husband and wife were among 18 people who died at that facility. Well, today their family told Channel 9 they were never told that either one even had the virus.
I'm so angry with Citadel. I'm angry. They did not do what they were supposed to do.
We'll dig deeper into this story in 30 minutes and talk about the couple of 30 years who died within just weeks of one another, again because of COVID-19.